Evaluating the eyes in individuals with leprosy is essential because the disease can damage the facial nerves responsible for eyelid movement and corneal sensation. Loss of protective blinking and reduced corneal sensitivity increase the risk of dryness, injury, and infection, which can lead to serious complications such as keratitis, vision loss, or blindness if left untreated. Early detection of nerve involvement or ocular changes allows for timely interventions, including protective measures, medical treatment, or referral to an eye specialist. Regular eye evaluations are a vital component of comprehensive leprosy care. The screening process should start even before you begin talking to the patient. Draw your attention to the patient's eyebrows. Patients with untreated leprosy and lepromatous leprosy cases of long duration may have thinning or loss of the eyebrows. Next, does the patient have eye redness or irritation? Is there excessive tearing, especially along the lower lid margin? A positive finding should prompt screening by an ophthalmologist to prevent development of eye complications that are more serious. To evaluate sensory function in the eyes, begin by watching the patient blink. Is the blink consistent and symmetrical? The absence of a normal spontaneous blink reflex can indicate impaired corneal sensation. The inability to blink when prompted or an uneven blink may be a sign of facial nerve damage and lagophthalmos. In Section 1 of the form, Sensory Testing, mark S for normal symmetrical blink, indicating normal corneal sensation. Mark L if a delayed or asymmetrical blink is observed, indicating impaired corneal sensation. Next, ask the patient to close his or her eyes lightly as if sleeping and look for a gap in the eyelids. Then ask the patient to close his or her eyes tightly, again looking for incomplete closure. Finally, instruct the patient to close their eyelids tightly and keep them closed against resistance. Then attempt to reopen the patient's eyelids. If you are able to produce a gap in the eyelids, this is an indication of eye muscle weakness. Also, observe for Bell's phenomenon, which is a rolling of the eyes up under the lid in an attempt to moisturize the eye and compensate for the inability to close the lid. Any signs of lagophthalmos require an immediate consult with an ophthalmologist. In Section 2 of the form, Muscle Testing, record S if the patient can hold the eyes closed against full resistance. Record W if the patient can close the eyes but is unable to hold them closed against resistance. Record P if the patient cannot fully close the eyes. In Section 3 of the form, HD deformity, check if any of the following are present: lagophthalmos, or incomplete eye closure, redness and irritation of the eye with discomfort or pain, or corneal opacities which present as white hazy areas within the cornea. Additional complications that should be noted include ectropion, or an outward turning of the eyelids, and can be associated with lagophthalmos and/or weakness of the orbicularis muscle. When the lower lid is turned down, the collection of tears is hindered, and this can lead to loss of moisture in the eye. Entropion, or an inward turning of the eyelid, which causes your eyelashes to point inward and irritate the eye. Both entropion and ectropion should be evaluated by an ophthalmologist. Trichiasis is a condition where one or more of the eyelashes grow inward and irritate the eyeball. It can be caused by infection, inflammation, or eyelid scarring. An irregularly shaped pupil can be caused by uveitis, which may cause inflammation and scarring of the iris. It may also be caused by damage to the muscles which control the shape of the pupil. The screening process should also include testing the patient's visual acuity using a Snellen eye chart if available. Test each eye separately and have the patient wear their usual corrective glasses or contacts during the exam. A score of 2200 or worse is considered to be a decrease in visual acuity. If no eye chart is available, have the patient count fingers at a distance of 20 feet. In Section 4 of the form, Visual Acuity, record your score for each eye. Once your evaluation is complete, in Section 6 of the form, give the patient a WHO grade based on your findings. If the patient has a normal blink, the patient is given a WHO grade of 0. If the patient shows a loss of protective sensation in the eye with a delayed or absent blink, but they have no HD-related deformity and their vision is better than 2200, they are given a WHO grade of 1. If the patient has a delayed or absent blink, and they also have an HD-related deformity or a decrease in visual acuity, they are given a WHO grade of 2. If you would like more information on performing an eye screen or have questions regarding Hansen's disease, contact the National Hansen's Disease Program at 1-800-642-2477 or visit our website at www.hrsa.gov/Hansen's-disease.